going to do kinesiology in the articular system today. All right. Let's see if we can get this. All right, there we go. We're gonna have to move me though, it looks like. Over here. All right, we're gonna play some charades today. How do I get up that? There we go. All right, kinesiology. Kinesiology is the multidisciplinary study of physical activity or movement. It involves anatomy, biomechanics, physiology, and psychomotor behavior. So that is the definition of kinesiology. For our purposes in our class, we're going to call kinesiology the study of movement. That focuses on exercise stress, movement efficiency, and fitness. If you continue on with exercise science, if you're interested in these types of things, you will, or athletic training, physical therapy, you will have a course on kinesiology when you are in college. We're going to skip this one. We talk about diarthrotic. We're going to go ahead and explain what that is. So first of all, the articular system. The articular system is all of the joints of our body. It makes up the articular system. So we have lots of different joints in our hands, our wrist, our elbow, our shoulder. It's called the articular system. The series of joints that allow movement of the human body. There's more than 100 joints that connect 206 bones. You have articular or joint cartilage. It's called articular cartilage because it's on the ends of the bones where one bone articulates on another bone, where two bones are connected. There's three types of joints, kind of broad categories that we'll talk about. The first one is diarthrosis, the second one is amphiarthrosis, and the third is synarthrosis. Diarthrotic joints are freely movable joints. So the hip, the knee, the elbow, that's what we're going to be talking about today. The second one is amphiarthrotic joints. These are slightly movable joints. For example, the pubic symphysis can move just a little bit. The ribs, the joint there can move just a little bit. And then we have synarthrotic joints, which are immovable. They're like sutures, the different parts of our skull where they're connected together. We do not want them to move. They're not movable. All right, so with diarthrotic joints, freely movable joints, that's where we'll spend our day in class today talking about. The ends of all the bones are covered with articular cartilage. I mentioned that. The shape of the bone allows for different range of motions. So really, the greater the range of motion that a joint has. So I think about my shoulder and how much range of motion that I have in my shoulder, and then how much range of motion I have in just my elbow joint. So very different. But my shoulder joint is not as stable as my elbow joint is because due to that range of motion and the bony surfaces that articulate together. So the greater the range of motion, the less stability in a joint. Stability is determined by three factors. The shape of the bones and where they come together, so like ball and socket, would be the shape of the bone where it comes together. The ligaments that surround that joint, and then muscle tone. So in the shoulder, we have some muscle around this ball and socket joint, but we have a lot more, the glutes, the gluteal muscles around the ball and socket in our hip joint. We have 6 types of diarthrotic joints. The first one is a pivot joint. I remember pivot, you guys know, like a basketball pivot. You move around on one point. That is a pivot. So a pivot joint, we've got a couple. One of them is our radius and ulna pivot here in our elbow. And we have one in our neck that allows us to rotate our head side to side if you isolate the vertebral column and take that part out, because we can do all kinds of different things when we move our vertebral column. But there is a pivot joint right where our skull sits on the vertebral column. A gliding joint. We have gliding joints in our carpals and our tarsals, which allows slight movement. If I had Mr. Snow here or somebody else, we could show that off a little bit. But these are gliding joints, so the joint goes like this. Allows the bone to move in a sliding motion back and forth, or front to back. A hinge joint. A hinge joint is like a door. It opens and closes. That's all it does. My elbow joint is a hinge joint. All it does is open and close. The only reason I can do this movement is because of the ball and socket in my shoulder. So this is only a hinge joint. It only opens and closes, or what we will call flexion and extension. The next 3, a condyloid joint. We have a condyloid joint with, if you do the finger wag right here, this joint is a condyloid joint. It allows you to move forward and back and side to side, but you cannot rotate. You do not want your finger to rotate. So metacarpals, metatarsals, well, we're gonna skip the video, but there's a basketball player that did the finger wag, and remember that as a condyloid joint. A saddle joint. A saddle joint is like you take two Pringles and you place them on top of each other like this. They complement each other, or like a saddle of a horse and then another saddle. The shape of the two bones complement one another. The thumb, you have two of these saddle joints, and they are in the thumbs, which gives us that opposable thumb. Ball and socket joint. There are four. We have them in our shoulders and our hips. It's where the bone with rounded end fits into the concave cavity of another bone, and this provides the widest range of motion, but it's not the most stable. All right, we're going to talk about movements. I'm going to stand up. There are 18 movements that we're going to talk about. The first one is flexion. So if I flex my elbow joint, it is this motion here. So this is flexion. I am decreasing the angle. I am decreasing the angle between two joints. Extension is this. I'm extending my elbow. So I'm increasing the angle between two joints. The third one on this slide is hyperextension. Some people, they can see hyperextension in the elbow. I maybe have a little bit, but not a whole lot there that you can see. But that is going past its normal range of motion. It's called hyperextension. The next two are abduction and adduction. The only letter that's different is the AB or the AD. So abduction, if there's an alien abduction, that means an alien comes down to Earth and takes someone away, right? So if you think of an abduction, we spray paint a line. This is the midline of our body. We spray paint a line down the middle. If you take something away from the center line of the body, that is abduction. So the rest right now is arm abduction, abduction. Adduction is adding. You guys have added for your whole life. You're going to add the limb back towards the center line of the body. Abduction, adduction. We have flexion, extension, and hyperextension. We have internal and external rotation. So if we rotate, in order to rotate, we need to isolate, bend the elbow to 90 degrees here. This is internal rotation. This is external rotation. So you can do the same thing. It doesn't matter whether it's here. This is rotation here, or here. That is rotation. Circumduction. I pretend like I have a spray can in my finger and I'm going to spray paint a circle. That's called circumduction. Spray paint a circle on the wall. So this is circumduction, arm circumduction. You can also have leg circumduction where you're making a circle here. One life example with my knee injury, when I walk, I often circumduct, or I swing my leg out a little bit. That would be a circumduction with a gait. Supination and pronation. In order to do this one, we have to isolate, so the elbows need to be locked in by your sides. Your hands are here. Supination, you're going to make a bowl of soup. So you're going to turn your palm up. This is supination, like drinking a bowl of soup there. Pronation, if you crawl prone on the ground, that's face down. So pronation is palm down. Supination, pronation. We had flexion, extension, abduction, adduction. Plantar flexion and dorsiflexion. All right, plantar flexion, the bottom portion of your foot is called the plantar side of your foot. Some of you may have had plantar's warts, or you've heard of a plantar's wart before. That is, it's a seated wart that's on the bottom of your foot. So the bottom part is called plantar. The top of your foot, where's a dorsal fin on a shark? Dorsal fin on a shark is on top, right? So the top is the dorsal portion of your foot. The bottom is the plantar portion. So if we do plantar flexion, we are going to put our toe downward. That is plantar flexion. Dorsiflexion is dorsi, remember the top, pulling the foot up, the toe up. You'll feel the tibialis anterior here flexing on that. So if I have plantar flexion, see if I can be on the screen here. Plantar flexion and dorsiflexion. Plantar flexion, dorsiflexion. We had flexion, extension, abduction, adduction. Inversion and eversion. This is often used with the foot. We talk about inversion and eversion on ligament springs with the ankle. Most ankle springs, due to the bony portions of our ankle, are inversions. So inversion is turning the plantar side in. Let's see if I can get on screen. So this would be an inversion sprain, and an eversion sprain is a plantar portion out. Inversion, eversion, abduction, adduction, flexion, extension. All right, we have protraction and retraction. Protraction is moving forward. So we can protract our shoulders, we can protract our head, we can protract our jaw. It's just moving forward. If we retract, we pull our shoulders back, our head back, our jaw back in. That is retraction. Americans, we sit at desk. We spend a lot of our day at a desk. A lot of Americans do, typing on a computer. So the shoulders get protracted, the neck kind of gets protracted here, and we need to work on strengthening the back portion of our body to pull the head back, the shoulders back, and so we don't have that. It's called retraction or bringing back, retracting. So protraction, retraction. Elevation and depression. Let's talk about shoulders. There's a picture on here, shoulder. This is shoulder elevation, and this is shoulder depression. Elevation and depression. The shoulders aren't necessarily sad, it's just going down. Elevation is moving up. If you're on a mountain, you're going up in elevation, you're moving up the mountain. The next one is opposition. Opposition is it moves our thumb and touches our fingers. I think when Mr. Snow, we talked about life of the athlete stuff, we talked about one of the skills was this skill right here. But opposition is what makes us different than some other disorders of joints. We have bursitis, arthritis, rheumatoid arthritis, osteoarthritis, gout. Anything that's itis is inflammation of. Remember that. All right, bursitis. So bursitis is inflammation of the bursa sacs. It's a synovial cavity that is around a joint. You can see this is from pretty severe bursitis right here. That guy on his elbow. Its common sites would be elbows and shoulders for this bursitis. Get off of there. There we go. Arthritis is inflammation of a whole joint. There's more than 100 varieties of arthritis. There's no cure, but there's a lot of treatments that kind of mask the symptoms of arthritis. This is arthritis in the knee. That's what you're seeing there. This is arthritis, some type of arthritis in the hands, and it's severely crippling, and people aren't able to, maybe they can't supinate, maybe they can't turn on their car, maybe they can't eat because their hands are immobilized with that swelling in the joints. Rheumatoid arthritis is connective tissue disorder resulting in severe inflammation of small joints. It is severely debilitating, like I just mentioned. Rheumatic fever is a bacterial infection that can be carried in the blood to the joints, which can cause rheumatoid arthritis. If undetected in childhood, this can develop into rheumatoid arthritis. Osteoarthritis. Osteoarthritis often happens because over time, as the meniscus and the cartilage wears away, then the bone starts grinding on each other, and that's what causes that arthritis. Another thing, injuries, an ACL injury or a meniscus tear, PCL injury, MCL, those injuries when you're young and over time, that can start to cause that arthritis or osteoarthritis, which is in the joint. Osteo means bone, articular, remember the articular system is the joints, and itis is inflammation. So we have osteoarthritis. Osteo is bone, arthritis is joint, inflammation is itis is inflammation. This is lesions of the tibial plateau right here. This is actually an image of my tibial plateau with lesions on it. This is medial femoral condyle. These are lesions here, and I'll talk about in class how they went and took those lesions out and put somebody else's a bone plug to cover that spot to try to prevent some of the pain. Continued, this is the femur, the end of the femur right here, the medial femoral condyle, and you can see the issues there. I believe that's a suture and a meniscus. This is an osteochondral allograft. So this is the bone plug that they put in the end of my femur to cover up. They took the part that was bad out and put this piece from somebody from a cadaver, put this piece into my knee as the end of my femur. Gout. Accumulation of uric acid that crystallizes in the joint at the base of the large toe and other joints in the feet. It's more common in men. It may hit sudden, just may come on suddenly, and it feels like your big toe is on fire. That is gout, an accumulation of crystals of uric acid. Anatomical planes. All right, we have 3 different planes that you will need to know for your quiz. The first one is coronal or frontal, and that is going to divide the body right here, front to back. That's called the frontal plane. The next one is sagittal, which draws a line right down the middle, and it splits right to left. That is the sagittal plane. And then the third one is axial, which cuts the body from top to bottom. All right, terms that you will need to know moving forward in this class. All these things, all the movements, you'll need to know because we use them regularly. Also, you'll need to know these terms. So if you spray paint a line down your body in an anatomical position that we've talked about, anything towards the middle is called medial. Anything towards the outside is called lateral. Let's talk about inferior and superior. Something is inferior, it is below. Something is superior, it is above. So superior, like your boss is your superior. Some inferior is somebody that works under you. But we need to talk about proximal and distal. So with limbs, when we're talking about our appendages, your arm could be up here, and we can't use inferior and superior because that changes. So with limbs, we use proximal, which is close, in close proximity, and then we use distal, which is at a distance. So proximal and distal. My elbow is proximal to my hand. Superior, inferior, we got that one, distal, proximal, lateral, medial. The last ones are anterior and posterior. So anything towards the front of the body is called anterior. My anterior knee is the front of my knee. The posterior, you guys heard Coach Jones talk about your posterior chain when you're in weightlifting class. But the posterior is the back portion of your body. So anything towards the back is posterior, anything towards the front is anterior. 2 types of movements, closed kinetic chain and open kinetic chain. A closed kinetic chain is where the distal ends, so if I'm doing a squat, that is a closed kinetic chain. An open kinetic chain would be if I have weights in my hands, see how the distal portion is open? That is an open kinetic chain. And we'll talk about those types of things when we talk about rehabbing injuries with the closed kinetic chains than open kinetic chains. And at different times in the rehab process that you will use those. All right, thanks for watching today. This is Kinesiology. You should have your notes completed for Kinesiology. You will have a quiz shortly. Look for a date on Canvas. Have a good day.